Good morning, everyone. We're just letting all of our participants join the presentation. We'll be starting in a minute's time. Okay, everyone, we're going to get started. Good morning. My name is Pamela Robinson, and welcome to our third COVID in Focus webinar presented by City Building Ryerson. This is the third of a four-part series in which we highlight new Ryerson research at the intersection of city building and COVID. I'm Pamela Robinson. I'm the director of Ryerson School of Urban and Regional Planning. I'm also the interim academic director of City Building Ryerson. Joining me today, we're super lucky, is my co-host, Amber Grant. Amber is a doctoral student in the Environmental Science and Management program at Ryerson University. Her research focuses on examining environmental justice and urban forest management and community tree planting. Beyond her research work, she's an avid cyclist and an active transportation enthusiast. And I'm really glad to have Amber here because, as you'll start to see soon at Ryerson, our approach to city building is broad. We're pitching a big tent and we're bringing diverse perspectives beyond the typical planning and design points of view around city building to start to understand how these points of view can inform a more equitable, inclusive, and sustainable city. Amber, over to you.
Great, thanks so much, Pamela. I'm joining everyone today from Toronto, the place where the trees stand tall in the water, or the dish with one spoon territory, a treaty between the Anishinaabe, the Mississaugas of the Credit First Nation, and the Haudenosaunee. And I've been thankful to live and work here for the past 10 years. I recognize my responsibility to always be unlearning colonial ways of thinking, challenging racist and colonial systems, and to work in solidarities with Indigenous peoples. I think it's important that we reflect about the land in which we occupy and how we can work to be better in solidarity with Indigenous peoples who have faced and continue to face systemic violence and oppression due to the effects of colonialism. Moreover, engaging in reflexive practice such as this is inherently part of realizing equity and inclusion in our remote classrooms and learning spaces.
Thank you, Amber. So today what we have is a short presentation. It'll be about 17 minutes, followed by a moderated question and answer period. If you look at the bottom of your Zoom screen, you'll see that you can submit questions in the question and answer. And if there's a question that someone else has shared that you think is particularly good, you can vote on it to help prioritize the strongest questions. We really encourage you to use that function so that at the end you're able to ask questions to Dr. Rothman. This webinar, along with the others in this series, are going to be recorded, as you know, because you got the little voice prompt, and we're going to share them on the City Building Ryerson website so that if you find this interesting, we'd encourage you to share it. I'm delighted today to present the research of Dr. Linda Rothman. She's an assistant professor in Ryerson School of Occupational and Public Health in the Faculty of Community Services. She's also an adjunct scientist in the Child Health Evaluative Sciences at the Hospital for Sick Children in Toronto. Linda's research focuses on pedestrian and cycling injury prevention in urban environments. Today, what Linda will present is her new research on how Toronto's active transportation policy responses to COVID-19 have impacted road safety for part of a larger cross-Canada research project and a collaborative effort that explores road injury during the pandemic. I'm now going to pass the microphone over to Linda to begin her presentation. So keep submitting your questions through the Q&A, and we look forward to having her respond in a few minutes' time. Thank you.
Good morning, everybody. Thank you so much for having me today. I'm quite excited to be here. I've been attending some of the previous presentations, and I think this is a great series, and I'm happy to be able to contribute to it. So my presentation is actually something that is in the preliminary stages, some research that we've just started with the COVID pandemic, but it builds on some of the stuff that we've done in the past. And what I wanted to present is the road safety issue as a public health issue and the effect of COVID-19 policies on injuries among vulnerable road users. So first of all, I wanted to introduce our team. I've been so fortunate to be working for many years with a multidisciplinary team. And this team is focused on generally unintentional injury and mostly in children. My focus for years was out of hospital for sick children and on child injury prevention. This team is across Canada. We have members in Calgary, Montreal, Vancouver, and in Toronto. And we all have been looking at active transportation, motor vehicle collisions, road safety policy, and the built environment in cities. The great thing about this team is that we represent such a wide diverse of backgrounds, professional backgrounds, things like epidemiology, geography, urban studies, policy analysis. We have an orthopedic surgeon, pediatrics, social marketing. So we have a really wide group of investigators and collaborators on our research team. I want to also mention that this work has been catalyzed. So basically we started with a 5-year CIHR, Canadian Institutes of Health Research funded grant called Child Active Transportation Safety in the Environment, or the CHASE. We all came together in the most recent form, and we have started to look at this whole issue around COVID. I do want to call out Naomi Ann Berber. She was a student with us from the University of Toronto Dalla as an MPH this summer, who did a lot of this background work for us. Thank you, Naomi. So why do we consider road safety a public health issue? Usually people think of public health issues as an epidemic like we're having right now, or some type of infectious disease issue. But the true definition of a public health issue is when a disease burden is high and is increasing. So there's a burden in the population, a health issue, and it's increasing. A second qualification is that the problem is distributed unfairly, maybe different socioeconomic groups, maybe different sex, geographic areas, things like that. And the other thing is that group action is required to solve the problem in a public health issue, and where there is some possibility of prevention at a population level would be considered a public health issue. So I do want to emphasize that not a lot of people know this, but road injury is a leading cause of death in children 0 to 14 in Canada. It's a single leading cause of death in Canada. In 2017, we had 69 fatalities, and that actually represents 60% of fatalities in kids this age in Canada. And with that came 37,000 injuries. A third of these injuries are pedestrians, or fatalities of pedestrians, with 22 in that year, but also there were 5,000 pedestrian-specific injuries during that time. And I do want you to just take a quick look at the bottom. You know, we think of injuries is not that much of an overall injuries, not that much of a problem, but they actually account for 44% overall injuries in kids, which is a very substantial number. Also, just to bring this up, is road traffic injuries are the second leading cause of death after self-harm in Canadian adults under the age of 50. So again, this is a huge problem in Canada. And you can see here since 2010, generally road fatalities have been increasing in Toronto. This is Toronto specific from our Vision Zero dashboard. You know, we started off in 2010 with 43 and have gone up to 64 in a single year. And I do want to call out the fact that look at what's happening with pedestrian injuries. They've really gone up from 20 up to 39, and we had a high of 44 in 2016. So this is an increasing problem in the city of Toronto. And I'm sure all of you have heard lots of stuff, maybe not this year, but last year in the media about pedestrian collisions. We've had other things to worry about this year, but it really has been something that has been quite noticeable in the media and across the board, that things are getting worse in terms of particularly pedestrian collisions in our city. We've done some work looking at socioeconomic status in Ontario, and other people have done similar types of work, but to fulfill the criteria of a public health issue that road injuries distribute unfairly, we found in a study that we did, we just recently published, that overall there's been a decrease, 18% in Ontario child pedestrian collision emergency department visits. However, if you break it down by income groups, the rates have actually increased by 14% in the lowest income group and decreased substantially more in the highest income groups. So that is the ultimate in inequity. Things are getting better in the high income and getting worse in the low income groups for kids. We also started to talk about, like, is this because kids are walking more in low income areas? Or is this because they're unsupervised? Well, you know, some of that may hold true, but we had a feeling that there might be some differences in what the roadway environment was going to look like and maybe contributing to this issue. And when we mapped things like speed humps, which have shown to be very effective in reducing collisions, we found that the speed hump density is 4 times lower in low income areas compared to high income areas in Toronto. And in fact, the child pedestrian collision rates in Toronto were over 5 times higher in low versus high income areas. So we do have a really inequitable situation in terms of child pedestrian collisions in general. And actually, taking on my overall injury hat, it's something that carries over into all types of injuries. We've done quite a bit of research looking at road design and how we can reduce collisions. And we actually do have a methodology that we've been doing over the years, looking at pre-post, the collisions before something's been installed versus after something's been installed. We looked at speed humps. We've looked at cycle tracks. We've looked at reducing speed limits. That was a recent study that we did from 40 to 30 kilometers on the local roads in Toronto. And we actually looked at streetcar right-of-ways, and we did find substantial decreases in collisions because of the installations of some of these types of road design features. So we do know what works. Now we just have to figure out how to implement it equitably. So again, we decided with the road traffic injuries to look at what's happening with COVID-19. We wanted to look at how COVID-19 stay at home, so that should say stay at home, and physical distancing policies affected road traffic injuries and deaths over the last few months. And we also wanted to look at the effects of some specific COVID-19 related local mitigation strategies on road traffic injuries and deaths. For example, some of the things like the lane closures, the new bicycle lanes, some of the regulatory changes such as speed limits, the shared space. So this is the plan going forward of some of the things we want to be looking for in terms of what's happening with COVID. We've started the first steps. We were funded in the summer by Ryerson's Faculty of Community Services Seed Grant to get going on this. We haven't, been able to do too much, but we're hoping to continue this work. Right now, we looked at the dates of policy introduction and relaxation in the 4 Canadian cities related to the pandemic. So we created some timelines with the policy introduction and relaxation. And then we started to map the collisions before and after the start of the pandemic, specifically in Toronto, just because we wanted to focus on Toronto with the limited amount of funding we had to start off with. The other thing that we really wanted to do, and I'll talk about this more in a minute, is investigate different sources of vehicle, pedestrian, and cyclist and public transit data, because that's really important to calculating rates. And again, I'll talk about this in a minute. We have made an application to the Ontario Ministry of Transportation to look at these issues in Toronto specifically. And then also we're just in the process of submitting a Canadian Institutes of Health Research grant to conduct this study across the 4 cities. This is just an example of one of the timelines that we did. This is the physical distancing policies initiation. We have a similar one for when things started to open up. And what we wanted to do is pick out some of the most important policy implementations that might affect collision rates. All of the ones that we've put on here, we're not really concerned so much about masks and things like that, but it's more about things that might affect active transportation and might affect collisions. We did this in all the cities, but I'm just showing this one because of time. So the first thing we started to look at is some volumes, some transportation volumes. And I'm sure some of you have seen this graph before. It's an Apple mobility trends with the policies on top of it. I have to emphasize that Apple mobility trends only reflect requests for directions. So these are only if you're putting in how to get somewhere, that's what's being recorded on here. So it's not all that accurate in terms of actually 100% what's happening out in the community. But you can see here with the provincial state of emergency, driving is blue, walking is gray, and transit is orange. it crashed right down. This is from January, so this is the change since January. As the weather got a little bit better, things started to open up. You can see the driving and walking have started to increase again. But look at transit. Transit is just staying up. We have this until September. It is staying quite low. So people are not going back to public transit so readily. Okay. Now the issue, okay, we'll go on to this. I wanted to show you a couple of maps also, but with the collisions, just the numbers. 2019 is on the left, 2020 is on the right. The top two are during the stay-at-home and physical distancing period from March 17th to March 18th. And you can see there's been a big drop in the numbers of collisions here to here. There was a drop from 53 collisions to 24 collisions, and the rates per population went from 1.94 per 100,000 to 0.88. After stage one reopening, similar pattern, quite a large drop between the 2 years. What I do want to say here though also is that you can also see that there's been a lot less in the downtown core. People are not working downtown probably as much. Most of those people are probably working at home. So there is like a decrease in the downtown numbers going on. In terms of rates, we calculate our rates of collisions per number of population living in those areas, which is not the best way to be calculating collision rates. We know a lot of people come from other areas to work downtown and may end up, unfortunately, getting involved in a collision. So our big issue in injury prevention research in this area is we don't have good denominator dates. So we don't have good volume numbers to know that of these many people walking, this number of people get hit. Of these number biking, these number of people get hit. This is something that we really want, we think about all the time, and we really want to see if we can tease a little bit more information about this with this project. These are the killed or severely injury rates with all ages in Toronto from January until June. We don't have up-to-date collision data right now. We're hoping we'll get some soon. Again, with more funding, we'll be able to pursue the data with a much more stronger focus. But right now we only had until close to the end of June. And you can see before, this is 2019 is blue, 2020 is orange. There's no real difference in the collision rates. There's a little bit of variation. We get to the March 17th, a huge reduction in collision rates, 65%. Things starting to opening up. We still have a huge reduction, but you can see maybe things are starting to trend upwards again, which is not what we want to get. Basically, what this pandemic did was reduce enough the traffic and enough of the risk on the roadways that we ended up basically almost solving one of the biggest killers in our city in terms of road traffic collisions. We need to figure out how to keep this thing going, how to keep these reductions down, and we do know things that work. So this is all about what this research is about. The top two, pedestrian and motorist, you can see that from March 17th, there was a huge reduction again. 2019 is the blue, orange is the 2020. Things hopefully may be creeping up again in the early spring, but we're hoping that that doesn't continue based on some of the interventions that hopefully are being implemented. Same thing with motorists. They're starting to creep back up to the 2019 rates. Cyclists and motorcyclists, there wasn't all that much of a drop, okay? But the pedestrian motorists, there was during the stay-at-home period. By age group, B is before, D is during, and R is with the reopening, starting with the reopenings. We had to clump these together because of small numbers. And again, they are small numbers, but you can see again that from 2019, there's been a drop during and even after the reopening in all the age groups. Drop during, reopening. The biggest drop was in the 15 to 24-year-old group. These are the rates. So the next part of the question are, what are the effects of specific COVID-19 related local roadway mitigation strategies on road traffic injuries and deaths? Now, we have not started this work yet. What we have done so far is start making lists. It's a bit of a busy slide, but basically these are the kind of things that we're going to want to look at over the next few months or the next couple of years, actually, to see whether or not these have had effect in decreasing pedestrian collisions, cyclist collisions. So things such as expanding pedestrian spaces with curb TO, the quiet streets, street closures. We have a couple of things around cycling infrastructure, the additional 40 kilometers of the city's cycling network, as well as the new bike share Toronto expansion announced, expanding commercial spaces, and a big thing right now is speeding. We have started an automated speed enforcement program, which we are beginning to issue tickets to speeding driver. We know speed is one of the biggest determinants of collisions and also collision severity. So that is one of our best things to attack in terms of reducing collisions. Our group is actually working with the City of Toronto right now to evaluate the automated speed program and look at whether or not, how effective it is in reducing speeds in the city. So going forward, we plan to hopefully get some funding. That's number one, but to update the collision data as the reopening and closures occur. Again, we are now in not looking so great for the fall in terms of numbers of COVID. We do expect there may be some more closures happening. So again, our timelines are going to be a bit messy. We had the closures at the beginning, we had the gradual reopenings, and we may end up having to put some more closures back onto the timelines and actually look at the trends in the collisions with respect to these things. We want to continue or start the pre-post analysis of the local mitigation strategies. We do want to start looking at better sources of vehicle, pedestrian, cyclist volume data to calculate some more accurate rates. So we're going to start, we have a lead on a company that provides, with costs of course, data from smartphones and vehicle navigation devices. So we're not just relying on Apple Mobility in terms of who happened to have mapped where they were going. So we are really going to try and tease out some better volume data. Also with the city is going to provide us with what they've got. And finally, we really want to integrate our other cities, our other team cities into this project so we can do some comparisons, see how things work in other cities compared to Toronto, and share what's effective and what's not. So basically, cities do need proactive interventions and policies to reduce road traffic injuries as the pandemic progresses and beyond. We can't just focus on what's happening right now. We need to make sure things work going forward. And our team's work will provide evidence to guide decision-making on important road traffic interventions. And evidence is essential. We don't want to be putting things in that potentially don't work. So the goal is to emerge, one of the goals, I guess, to emerge from the COVID-19 pandemic with cities that are much safer for walking and cycling. Thank you very much.
Thank you, Linda, for that great presentation. So now we're going to move into the question and answer part of the story of the webinar today. If you've got questions, you can answer them and ask them in the Q&A. Amber, I'm going to give the first question over to you.
Perfect. Thanks so much. And thanks, Linda. That was a terrific presentation. Really exciting stuff. I just had a question to get us started. You highlighted in your presentation that the majority of road deaths occur in low-income neighborhoods. You also mentioned that speed hump density is 4 times lower in low-income neighborhoods. You then go on to mention that road design modifications such as speed humps, cycle tracks, and reduced speed limits could all contribute to fewer deaths. In the short to medium term, as COVID remains a key concern for shaping travel behavior, what are some tangible ways that the City of Toronto can take action to facilitate more equitable access to this type of road safety infrastructure throughout the city?
Thank you. So some of those things that you're talking about are not short, medium-term action. Speed humps take a while to get put in. A lot of those things take longer term. There's a process that goes through for that. The City of Toronto, with Vision Zero, the Vision Zero Road Safety Plan, which started in 2017, which is the goal is to reduce injuries, severe injuries and fatalities to zero in the City of Toronto. This is based on a European model that a lot of cities are taking in. Vision Zero 2.0, which started in 2019, was very focused on being data-driven and equitable, and looking at things through a social justice lens and focusing on speed reduction. So the city has been really kind of looking at where the data, we've been promoting it with them as well, where are the collisions actually happening and where do we need to put the interventions. And there is some movement towards trying to do a little bit more of an equitable distribution of things across the city. There's a big focus on Scarborough just before COVID hit because they found that there was a lot of collisions happening there. Big wide roadways, suburban area, people were bombing down them. So they were doing some stuff on speed reduction there. One of the things I found really interesting with COVID is a lot of the active TO things. There's been a lot of discussion about this as well. Happened in downtown core areas or high income areas. Like, let's face it, there was not a lot of bike lanes going on in suburban Toronto. There are a few, but not a lot. There was a lot of focus on downtown higher income areas where the cafes were. So there's been a lot of people talking about, we need to reproduce some of this stuff in some of the other areas. Some of them are quite protective pedestrians. And going forward, we need to make sure there is equitable distribution. We also know that in lower income areas, there tends to be more people using public transit. They're frontline workers, they're more out in the streets. We need to be protecting in those areas and expanding some of these great programs that started with COVID into some of the lower income areas.
Thank you, Linda. Next question comes to us from Dylan Reed, who's an executive editor at Spacing Magazine and one of the leaders of the Walking Toronto Public Interest Group. Dylan's question asks about road design features. Are there any studies of whether or not the presence or the absence of sidewalks affects pedestrian safety, whether it's for children or the broader public?
It's funny, I've been asked that question a lot lately. There actually is no evidence or very little evidence that sidewalks, let me preface this with, we have our exposure data issue again. We don't know how many people are walking on those roadways. So most of the literature does not show a protective effect of sidewalks. And the reason for that may be because more people actually walk in those areas, so more people are more exposed to being hit. We need volume data. We need to know where the pedestrians are walking, especially kids. You make it pedestrian volume data on some of the major arterials because there are measurements done, but you don't get volume data from local roadways to know what's actually happening in the neighborhoods. Are there more people walking on those neighborhoods? Even with the sidewalks. Sidewalks may attract more people. That may be more people crossing the road. So short answer is no, there is no real hard evidence that sidewalks are effective in protecting, but I do want to preface that with, we do not know what the exposure and how many people are walking on those roads.
Thank you.
Great, thanks, Linda. One last question here from Sean Marshall. They write, thank you for mentioning speed humps. As the average consumer vehicle gets larger from sedans moving towards SUVs and other pickup trucks, are speed humps less effective? I don't own a car, but I rent on occasion and notice the difference on humps depending on the vehicle. Are other road treatments, such as curb extensions, for example, preferable?
So I don't know exactly in terms of the bigger cars and the speed humps. I'm assuming it still does slow them down. It's funny because the City of Toronto really, their traffic calming program was and is primarily speed humps. Other cities do have, we're starting to see more of the curb extensions. If you walk around some of the neighborhoods now, you are starting to see some of that. Those are effective. They have them, I think, a lot more in Montreal and maybe in BC. And again, this is why we want to look at this with our other cities. We do have a database that we have all our traffic calming things mapped in those 4 cities from our Chase study that I mentioned at the beginning. There are other effective means of slowing traffic down, not speed humps. We just have not been very creative in the city to introduce them, and there's a million reasons why, but yeah, we could be looking at some more different, that we don't have any roundabouts either, or very few, whereas other cities have more of those.
Thank you, Linda. We've come to the end of our time for this webinar today. So as we talked about at the beginning, the webinar is recorded and will be shared on the City Building Ryerson website. We've got one last webinar left in our series, and that comes on October the 22nd with my colleague, Dr. Rothman Mitra, and his webinar will focus on mapping children's healthy movement during COVID-19. So this will be the fourth of four in our COVID response series coming out of City Building Ryerson. Thanks to everyone who joined us today, to the 3 people who posed questions that we weren't able to ask and answer. Dr. Rothman will have access to them, so if you reach out to her through her contact information, you can follow up with her directly. We really appreciate you coming and have a great day. Thank you.